Hi, my name is Jared Van Vleet, and I will be presenting on Navigating Total Ankle Replacement, a Patient's Guide Through the Web. Ankle osteoarthritis, primarily post-traumatic, affects younger patients with extended life expectancies, significantly impacting their physical and mental quality of life. The classic gold standard treatment for this is an ankle fusion. However, recently, total ankle arthroplasty has made some advances and is now rivaling that of ankle fusion. So, with this in mind, we took to the web to see what our patients were searching when it comes to procedures like this. On January 3rd, 2024, we Google searched three terms: ankle replacement, total ankle arthroplasty, and total ankle replacement. We then used an SEO minion to generate multiple generations of frequently asked questions associated with these questions. We went out about 10 generations. We then used a program that pulled in all of these frequently asked questions, or FAQs, and the primary source associated with them. From there, we had roughly 1,000 or so FAQs and associated primary sources. We deduplicated them. We eliminated the sources that were behind paywalls, videos, PDFs, and as well as kind of combed through them to make sure that all the questions related to TAA. We really wanted to identify what patients were asking specifically on this procedure. We then used a couple tools to assess the questions, the FAQs, and the sources. The Rothwell classification was used to assess the FAQs. It grouped them into three buckets: fact, value, or policy. And then within those, there were subcategories associated with them. We then used the JAMA benchmark criteria for transparency, and this was used to assess the transparency of the sources associated with the FAQs. Looked at things like authorship, attribution, currency, disclosure. Finally, the brief discern is a modified version of the full discern, which is an 11-point test. The brief discern is a 6-point test that totals up to 30 and is based off of elements within the source. So initially, we found that the majority of the questions were fact-based questions at 47%. And of these fact-based questions, the most commonly asked were timeline to recovery. So patients really wanted to know what that process looked like after the procedure was over. Additionally, we found that the majority of sources answering these questions came from medical practices or hospitals at 44%, followed by academic institutions at 27%, and government institutions at 23%. From there, we looked at the brief discern. So we found that the medical practices and hospitals had the lowest score on the brief discern at 16 out of 30. For reference, about a 15 out of 30 is minimal quality. So a situation, as you can see, is being set up here where the source that is providing the most information on a topic doesn't score the highest in areas of quality. This is true for the transparency aspect as well. Looking down here at table 1, you can see that medical practices and hospitals, about 84% did not meet the JAMA benchmark criteria for transparency. So again, modeled over the grouping that is providing the most information on a topic is not doing well in either of these categories. So the takeaway from this, and we really hope that medical practice owners, hospitals, and even patients can look for these things by simply adding a author, putting the currency, citing your sources on your web-based pages. It not only enhances the information that you're providing on your website, however, it allows it to be distinguished from other low transparency and low quality websites. So as somebody who, if I were to be the owner of a medical practice, this is something that I would look to do, because I know when patients would log on, they would be able to, to tell that, oh, this is different than a website that doesn't have an author, has no date, and doesn't cite its references. So that distinguishing is key. Thank you very much.